At Weill Cornell Medicine, Department of Urology, we have the whole spectrum of advanced technology to treat the various kinds of stones, from the smallest stones to the most complex stones, and the whole spectrum of treatments that we give patients as options to treat these conditions.
Kidney stones are basically crystals that form based off of minerals and salts in the urine, and there can be many causes. They include genetic conditions, medical problems, diet, and medications. Family history can impact it. There are conditions called cystinuria, primary hyperoxaluria, and also can be some inherited conditions in how people process certain minerals that can affect patients' ability to form kidney stones. So we do these 24-hour urine tests where we're able to look at all the minerals and salts in the urine, and we're able to look at patients' risk factors for certain type of kidney stones, so everyone gets a personalized diet plan or they need certain medications, so everyone gets a very personalized treatment plan.
Well, there's non-surgical and surgical management of kidney stones. We would like our patients to be able to pass their stones without requiring surgery. It's called medical expulsive therapy, where the patient is instructed to hydrate aggressively and may even be prescribed some medications to help facilitate the passage of a stone. In cases where that does not occur, or where their pain is increasing and they need urgent intervention, there are procedures called lithotripsy, which is a term that means breaking up a stone. There are several options for lithotripsy. One is sound wave lithotripsy, where we use an ultrasound machine to fragment a stone from the outside of a patient's body. Another one is laser lithotripsy, where we use a lighted telescope to enter the patient's body through the urethra, locate the stone, and fragment it in a minimally invasive surgery with a laser fiber. Both of those surgeries are outpatient, and the patient usually will recover very quickly. For very large stones, we may have to employ percutaneous lithotripsy, where a lighted telescope is passed through a dime-shaped incision in the patient's side, and we access the kidney directly, and we're able to fragment the stone with an energy technology and suction out the fragments while we're fragmenting the stone.
At New York Presbyterian Queens, we're able to provide both surgical care and medical management of kidney stones, and we're able to provide the highest technology for treatment of the kidney stones and also prevention of kidney stones through medical management.
At NYP Brooklyn Methodist Hospital, we take care of a large, diverse patient population. Unfortunately, kidney stone disease is a very common disease affecting about 10% of the population, and we take care of patients from different cultural, ethnic, and social backgrounds with kidney stone disease.
At Weill Cornell Medicine, you can get the best outcomes using these techniques that we are offering with the most minimal invasive approaches.
We have several excellent surgeons that operate on kidney stones that are able to treat these patients effectively, safely, and with excellent patient outcomes. I think the most important thing, though, is that we're able to employ a multidisciplinary approach. Not every patient needs surgery, and patients who have had surgery often need medical management afterwards in order to try to prevent future stones from occurring. So we're able to collaborate with our colleagues in endocrinology and nephrology in order to maximize the patient's medical management of stones and work on the most important thing when it comes to kidney stones, and that's prevention.